if you are 32 plus weeks pregnant with Physicians and Midwives, you're in the right class. This is our birthday class. This is our preparing for the birth class, and we mean it as an adjunct to childbirth education. So this is not meant to be childbirth education class. We're not going to go over a lot of the kind of preparatory things that you would probably find in a childbirth education class, things like breathing techniques, position changes, those kinds of things. That's for childbirth education. And we hope that all of you guys have been doing a little bit of something to prepare on that front. This class is meant to be a capstone, if you will. We kind of go over and integrate hopefully a lot of the things that you have heard or have been hearing in childbirth education, and we incorporate it into our model. So what can you expect when you get to the hospital? What can you expect during your labor, the postpartum experience, etc., as we are going to do it for you as our patients at Physicians and Midwives. So before we kind of jump in, we'll introduce ourselves. I'm Kathleen Bell. I'm one of the nurse practitioners at P&M. I'm only in the office, so I will not be catching one of your littles. But you probably have seen me for prenatal care or for any kind of gynecologic questions or any concerns that you might have. I'm also the only lactation consultant for the practice, so I end up seeing a lot of you guys on the back end of things for any issues with latching baby or pumping schedules or anything like that. So I'm in office exclusively, but I'm looking around and definitely seeing some familiar faces. I'm at all the offices but Arlington, so that's probably where you've seen me if I know you. And then I'll let Stacy introduce herself.
My name is Stacy Stavlin. I'm one of the certified nurse midwives with the practice. I'm a hospital midwife, so I'm in the office 2 days a week, and then I'm in the hospital 2 days a week waiting for you. And so I've been with the practice for just about 2 years. I really like this model of care. I hope you guys enjoy the class tonight. It is meant to be interactive, so do feel free to just, a hand up here, a hand up there if you have a question as we go. Okay?
So here we are. Tonight I tell people, again, kind of informal structure. We are going to basically talk about the end of pregnancy, stages of labor, kind of general warning signs and symptoms, when we want you to give us a call, what you can expect from us in the hospital, and then postpartum. And then we finish up with the tour like I was just saying. So end of pregnancy, I always like this slide because I think a lot of us do feel that way as we approach the end. I've had a baby myself. I know Stacy has had babies, and you just kind of, everything hurts and everything aches and everything's been stretched out, and it's all fairly normal. If you've brought up any of these things to us during your prenatal appointments, we've probably said, yeah, that sounds pretty par for the course, and we're sorry you feel that way, and we'll see you next week. So again, just to kind of reassure you, a lot of this stuff is normal. So pelvic pressure, we have our lovely pelvis and baby here for you to kind of look at, but as you kind of round the corner into that 35th, 36th week or so, again, every woman's different, but generally that's when you're going to start to feel baby start to come down. And this is when you really feel that drop. So you get your lungs back, but then your bladder gives way and the pelvic pressure kicks in. And this is baby, I tell my patients, really just kind of finding their roadmap and testing their way. They have to kind of figure out how they're going to eventually come out. And the way that they do that is by coming down, floating up, coming down, floating up. They kind of bounce about to all the bones of the pelvis. They start to kind of push on various muscles, and they try to figure out how they're going to use all of this stuff down there to actually aid them on the way out. So you do get a lot of pushing and pressure and stretching. You get a lot of feeling of baby kind of moving and headbutting, and all of that is completely normal. This usually also kicks off some Braxton Hicks contractions, or your practice contractions. If you've ever had a Braxton Hicks, I would argue the whole practice thing or the not a real contraction. But it is a contraction that most women do feel. It's the feeling of the baby kind of sort of balling up, tensioning up, and then it releases. But the difference between these and true labor is that these contractions don't actually progress to anything. So you might have a good run of them one day or one evening. You might have about 4 to 5 in an hour, and then everything just stops, and that's it. Or you might kind of feel the baby just kind of tighten up, release throughout the day, and then it stops, and that's it. So again, these are kind of your practice contractions. It's how the uterus tones itself and gets ready. And again, it's all part of that trial run. How is all of this going to work in concert? Backaches, love it. There's actually a hormone in your body called relaxin, and as its name implies, it does exactly what you would think it does. Its job is to relax all of the major muscles and ligaments of your pelvis and of your lower back. Great for birth, not great for walking around in the 4 to 6 weeks prior to birth. So this is, again, when you kind of get the characteristic Bambi waddle and you're kind of doing like the pregnancy, you know, leaning back and you're kind of just sticking your belly out and your back is curved. It's because everything is really aching and loose. So again, it's all meant to help you in that last bit for birth, but it leads to a lot of backache and discomfort in the weeks leading up. Round ligament pain, this is the pain kind of underneath in the pelvis. A lot of women describe it as kind of a sharp shooting stabbing pain that's kind of in the groin down into the pelvis region. Some women also have vaginal discomfort with their round ligament pain. All of this is, again, fairly normal as everything stretches out and prepares for a baby. And then you also might have some spotting. Again, you know, we talk about all these muscles and everything that's kind of loosening up and preparing. The cervix also has to loosen up and prepare. Normally it just sits very, you know, non-pregnant uterus. It's just tucked right behind your pelvic bone. It's about yay big. And now we've got to get it to 10 centimeters dilated, thinned out to the consistency of a piece of paper, and in that process it's going to spot a little bit. Those surface blood vessels on the cervix are going to break apart as it starts to thin out and dilate. You might get some spotting, you might lose your mucus plug, you might have some mucus and spotting. All of that is fine. And we'll kind of talk as the PowerPoint goes on about when these things are kind of crossing the line into not so normal and we need a phone call. But for right now, all of this stuff is normal. Stay active, get a prenatal massage, chiropractic work, acupuncture, Epsom salt baths, belly bands, all of that stuff is completely fine. And if it makes you feel comfortable and just kind of able to put one foot in front of the other, all of that is completely fine. Any questions, concerns on any of this? But all of this is very normal.
So what can you do to prepare for labor? One of the very best ways to prepare for the birthday is through getting a healthy diet and exercise. It's recommended that you have 150 minutes a week of cardiovascular exercise. Now, does that mean you need to get to your target heart rate? No, you don't. You want to make sure you're at a level where you can still carry on a conversation. You want to make sure you're not overheated. You want to make sure you're getting that gallon of water a day, that you're staying hydrated. And then focus truly on protein. Protein it's the building block, right? And so protein is tissue integrity for birth. You know, the carbs, the added sugars, that's what's going to make a big baby. And the best thing you can do is to maintain a healthy weight and a healthy diet so that you have healthy moms, have fit births, have fit babies, have fit postpartum courses. When we talk about fetal positioning, you know, obviously head down is optimal, right? And your baby, go ahead, yeah. Your baby is trying to navigate the curves of the pelvis. And oftentimes, the way the pelvis is shaped, they have to enter with their head turned toward the side. That's fine. They will corkscrew down and around. But I will tell you that if you spend a lot of time reclining, putting your feet up at the end of the day reclining, the heaviest part of the baby is going to go towards your spine. That's going to make a wider diameter of the head entering the pelvis. If you spend more time sitting upright in the cobbler pose, or leaning over your counter at the end of the day, or doing your cat-cow exercises, you're going to foster a fetal position where the heaviest part of the baby is towards the front of your body. And that's going to be a narrower diameter for the baby's head to enter the pelvis.
And you can really, I mean, this is why we have the stall. You can really kind of see, I mean, when you come in kind of at that sideways, dare I say, angle with the front part, or excuse me, the heaviest part towards the front, you've got this going on. Whereas if you come in this way, it's not impossible. My charming daughter did it. But it's not impossible, but it's also not fun for anyone involved. And it's a longer descent. Yeah. Yep.
So, you know, with this backaches, you feel the instinct to do these exercises, right? So listen to your body and do your cat-cow stretches every day, morning and night. Take a break at lunch and do some. And you're going to help that baby find a good position. There are also things that you can do to ripen your cervix. We talk about this like we talk about making a batch of chocolate chip cookies, right? When you get the chocolate chip cookies ingredients out, you get the butter out of the refrigerator. Can you make chocolate chip cookies with a hard stick of butter? No. You have to set it out and let it soften so that you can actually mix it up. Well, we want your cervix to be like that softened stick of butter. And so there are things that you can do to help that happen. Studies show, this is science, this is not voodoo. Studies show that if you eat 6 dates a day, 6 dates, that you can have a softer cervix when you go into labor. That's a lot of dates. You're going to be so sick of dates, but it will help you. And remember, this is 90 grams of sugar. So take sugar out of your diet somewhere else because it's a lot of sugar. You know, what gets a baby in is what gets a baby out. And so your mission, should you choose to accept it, is to get a daily dose of semen. Intercourse, nipple, play, orgasm, all help to make the cervix ready for labor. Sex is healthy. The well will soon dry up. Drink while you have water. Okay? Raspberry leaf tea. This is not raspberry zinger, raspberry flavored tea. This is the leaf of the raspberry plant. They sell it at Giant. You can get it anywhere. It is a uterotonic, meaning toning the uterus, so that when you go into labor, your contractions are that much more effective. You can drink 4 to 5 cups of this a day. It tastes a little bit like dirt, but it helps. It really does help. And then probably most of you, it's safe for you to take evening primrose oil. Check with your midwife or nurse practitioner at your next visit and just make sure you're a candidate. But evening primrose oil comes in capsule form, and if you take it 3 times a day, 1,500 milligram dose each time, total of 4,500 milligrams a day, it will help prepare your cervix for labor. None of this is going to put you in labor, okay? But it will soften the butter. And then Kathleen talked a little bit about childbirth preparation. I will tell you that if you have good childbirth preparation, you're going to have a much more satisfaction from your birth experience. Fear creates tension, creates pain, which creates more fear, which creates more tension, which creates more pain. The more you know, the more you're going to be able to surrender to the power of your body in labor. And the more you practice those coping techniques, the more instinctual they will become once you're actually in labor. There are some classes through ANOVA on our app. There are links to those. If you know you want an epidural, an express class might be just the thing for you. If you know you want to avoid an epidural, I would suggest that you do either hypnobirthing classes, hypnobirthing, hypnobabies, they're kind of similar, or Bradley classes. Bradley is partner coach childbirth. There's a book called The Birth Partner that gives really good techniques for how your partner can help support you in labor. Do some research ahead of time. There are some online classes too. It doesn't have to break the bank. But I promise you, you'll be much more satisfied with your birth experience the more educated and prepared you are.
And we have a list of those classes. We try very hard to stay up to date on what's around the DMV area. We have a list that was actually just updated a couple of months ago. And so again, ask for that at your appointment. We can print it off of our shared drive. There's doula information, childbirth class information, some of those online options that Stacy was talking about. We've got those. So just ask for a copy of that document and we'll happily print that off for you.
There are studies that show that if you do have a doula in labor, that your outcome, you'll have a better outcome and you'll have a higher satisfaction with your birth. Now, What is a doula? A doula is a non-medical person who is there, who's an expert in comfort measures, who's there to support you continuously. Gives the partner a break sometimes, helps you remember to stay hydrated, tells you all of these position changes to get in, all of these comfort measures to help you delay your epidural, or even after the epidural, help you to find different position changes. And they are there not to give you medical advice, but to support you emotionally, physically, in every way, and to support your partner. Now, some insurance companies are paying for doulas. Check with your insurance company, because they do improve outcomes so much. They reduce your chance for a cesarean. And if you're looking for a doula, we do have a list. But right down this website, doulamatchnet, you can go on there and put in your due date and put in where you live, and it will give you a list of all the doulas that are available. It will tell you the price range. Some go from donation-based all the way up to your expert doulas that you end up paying $2,000. Yeah, like $1,500. But there's every price range on that website. Again, it doesn't have to break the bank. And if you don't have a professional doula, maybe you have a friend who has had a childbirth recently who might be able to help you. So continuous support is so very important.
So this, again, when we talk about cervical ripening, this is just a brief overview of the stages of labor, which you'll get into more when you do childbirth education. But you have this prodromal labor, and this is the cervical ripening part. So that previous slide where we were talking about dates and intercourse and red raspberry leaf tea and all of that stuff, this helps this portion of the labor. You are not in labor when you're in prodromal labor. You're not having regular contractions. You're just having this kind of crampy, uncomfortable feeling. Some women describe it as kind of akin to those first days of their cycle where they're just kind of uncomfortable. There's some pelvic pressure and some cramping. And you have little waves of contractions, some kind of fits and starts. That's the prodromal portion. This is the cervical ripening. This can go on for weeks before you actually go into labor. So again, if you come into the office and you're like, no, but I promise you, I'm like feeling this stuff. It's like achy. It kind of grabs a hold of me and it stops and starts. That's fine. That's normal. That is the ripening portion. And again, like Stacy said, you're softening the stick of butter. So this can take weeks. You're looking at a shorter timetable if this is baby number 2, 3, 4, etc. But that process still has to occur. And it's a chemical and a physical process that can take weeks. Then as we slowly transition, we're heading into early labor. So this is about 1 to 4 centimeters. Some sources are now even saying 1 to 5. This is early labor, and we want you to stay at home. The whole purpose of this class, one of our midwives, who is now no longer with us, but she went to a conference. She went to the American College of Nurse Midwives conference, and there was a great presentation there and some data there that show that women who can stay at home and hit the door to the hospital at 5+ centimeters dilated have less time in labor, less likelihood of C-section, better birth. Again, when we say better, we're talking about avoiding the operating room. We know that that's a subjective term for everybody, and how you define success and happiness with your birth is certainly up to you. We're talking about keeping you out of the OR, the operating room. We want you to have a vaginal delivery. As best we can, we want to help you achieve that.
That's door number 1.
Yeah, door number 1, exactly. So if you can do early labor at home, that's ideal. Again, we're not trying to be terrible people that prolong your suffering and not let you get an epidural until you're 5 centimeters. Some of you are also higher risk. We might want to see you in the hospital sooner than 4 to 5 centimeters. If you have specific concerns, please talk to your provider about that. We don't, if you have a history of having all of your babies in under an hour, please don't wait until you're 5 centimeters to come to the hospital. So again, there's exceptions to every rule, but generally we want you at home. Don't time your contractions. Everybody, first baby, anybody, first baby? Yeah. So you get really excited and you feel a couple contractions and you're like, let's start timing these because this is it. And then you're sitting there with like the stopwatch thing on your phone and you're like writing down all your contractions and you're like, that was really hard. That one hurt more than the last one. You should make a note of that. If you can have that kind of a dialogue with your partner about your labor, it's still early labor and you should just stay at home and get out of your head a little bit and not time things. Don't time them. Go for a walk, bake a cake, watch a movie, do something. I went grocery shopping in early labor. I knew I was in early labor, but I had things that needed to get done. So I got in my car and I drove to the grocery store and I walked around and I ran my errands. And every now and then one of the contractions was really hard. So I would just like stand beside my cart and go, fastest trip ever, because people get out of your way in the checkout line when you're doing that. So the point is, I knew that it was labor, but it was early, and I didn't need to be in a hospital having a contraction every 6 to 7 minutes. I could stay at home, I could cope, I could still make phone calls, talk, drive, etc. When you hit active labor, when you're 5+ centimeters, you are not going to need to be timing a single thing, let me tell you, because they are going to come, and they are going to come every 2 to 3 minutes like clockwork. They are going to knock you over. They are going to be intense. I say that not to be a fearmongerer. We've had children and survived and everything's fine, but it's not going to be anything you have to think about. They are going to be intense. Women usually turn inwards at this point. They want people to stop talking to them. They want you to get out of their way. They don't want to be touched. I could not have driven to the grocery store in active labor. They start coming, you're having to breathe, you're having to just kind of like, your body naturally assumes kind of squatting positions. You start to kind of rock back and forth, lift your legs up, etc. That's your body getting ready. That's probably when you're 5+ centimeters, and that's when we want you to call us and say, hey, I've been contracting. If it's your first baby, we want them every 3 minutes, lasting a minute for an hour. That's when we want you to call if it's your first baby. So you'll hear us in the office say 311. That's what that means. Every 3 minutes, lasting a minute for an hour. If this is baby number 2, 3, 4, etc., every 5 minutes, lasting a minute for an hour. Because again, we know that you're going to move a little faster than your first-time mama counterparts, and we want to catch you earlier. We don't need any babies on 395. So again, 311, 511, and this is kind of the general progression. Again, everyone's different. I'm sure every one of you could raise your hands and tell me a story about a family member or a friend who this wasn't their story. And that's fine, but we just want to give you the general idea. When you're in active labor, again, if you are choosing an epidural, this is a great time to get it. Your body's already done this ripening and this early labor stuff. You're in it. You're in a great contraction pattern. Baby is probably going to be fairly well dropped in the pelvis. This is a great time to get an epidural and to just kind of ride out that last part. If you're planning to not do any kind of epidural or natural or unmedicated childbirth, then this is when you're going to pull out all of your tricks. Everything you've learned in childbirth class, everything your doula is telling you. You're going to do the birthing ball. You're going to walk. You're going to hop in the shower. You might be doing, some massage or some counter pressure. You might want to sit in a rocking chair. Anything that you can do to just kind of, again, keep the momentum going and cope through your contractions. Any questions, concerns about any of this?
So yeah, as Kathleen said, we want to hear from you when you're 311 or 511, depending on first time or experienced mom. Okay? We want to hear from you when you break your water. What is it like when you break your water? Well, in the movies, you have that big psh, right? It's not the way it always happens. Sometimes it's a slower trickle. So if there's any question, if you're constantly soaking through your underwear, we'll tell you to put a pad on and see if the pad is filling up in an hour. If you're filling up a pad, that's your water breaking. Now, you do have increased discharge in the 3rd trimester, right? And sometimes, let's be honest, it's copious enough to actually run down your leg. If you're continuously soaking through things, we want to hear from you. Okay? If you're having bright red vaginal bleeding, that's more than just a spot, more than just a stripe on a liner, it actually looks like period blood, we want to hear from you. And then, obviously, you're all doing your kit counts every day, right? If you're having decreased fetal movements, if it takes you more than 2 hours to get 10 movements, we need to hear from you. We know that fetal movement is the very best indicator of fetal well-being. And usually when a kid's in trouble, the first thing to go is movement. If we can intervene in that early period, usually we can help. Don't sit on it. Don't go to bed and say, I'll try again in the morning to get my 10 movements. No, call us right away, okay? Please don't just come to the hospital and show up. We like to make sure, sometimes we have to shuffle nurses to make sure that there's somebody to actually care for you. We need to make sure there's a bed for you. And so call us first. Call the main number, our main office number.
370-4300.
Right? And then listen to the phone tree, and it will ask, do you think you're in labor? Do you need to speak to the midwife at the hospital? And that's the number that you'll push. Okay?